Hi everyone, I hope you're well. You know, I had an interesting experience at work yesterday. I consulted a gentleman on the phone. It was a telephone consultation. This chap was, I think, in his mid to late 60s. He had had a prostate cancer diagnosed 4 or 5 years previously and had a prostatectomy, so his prostate gland was removed. And he was doing fairly well. His PSA, the prostate specific antigen, was at a was slightly raised, but this was being monitored. It's not an uncommon finding. It was being monitored closely by having periodic 6 monthly and then yearly PSA blood test. Over the last year, his PSA rose quite high, and as a result, he had further investigations, and it was deemed necessary for him to have radiotherapy, which he had. He had radiotherapy over the course of 28 days, but then developed some back pain. Well, actually, he had a history of chronic lower back pain, which got worse during the radiotherapy and started developing radiation of that pain. So the pain was predominantly in his lower back, but was moving down his legs, and almost like sciatica. Now, he was on various painkillers, and he thought that this is how his life is going to be in his mid-60s until however many years he's going to have to be living with this pain. And he sounded really depressed and really dejected. But you know, through the consultation, I spoke to him about various options, things that we can do to help him by way of further scans, by way of radiotherapy, other analgesics or other painkillers that we can try that work really well with neuropathic pain, the sort of pain that he had. And I take this for granted, and I go through this multiple times over the course of a working week with various patients, and it's just what I do. But at the end of the consultation, he said something that really struck me, and I had to stop and pause and reflect before going on to my next patient. He said, "Dr. Kamara, thank you so much for giving me hope." That's what he said. "Dr. Kamara, thank you so much for giving me hope." And I thought, actually, it wasn't the fact that I mentioned a medication or a mode of therapy such as physiotherapy or possible further scans that we could do, but it was perhaps the way that I said it and the way the interaction went, the way the consultation went, and he left feeling hopeful, and that really stuck with me. Excuse, there's a car going by outside. That really stuck with me, and that when we see patients, as well as all the science and all the biology and all the pharmacology and all the physiology and all the anatomical descriptions that we take on board towards our management plan, it's important to give patients hope, not false hope, but to give them realistic hope that all is not lost, that their life can be better, their life can be improved. And I want to leave you with hope that there is that there is light at the end of the tunnel. Okay, when the sun sets, it will always rise. Whatever difficulty you're going through today, it will get better. And if you feel positive about that, I think you've got a useful tool, a useful armory to work with that will make whatever intervention your clinician advises be more effective. Well, have a great day, and you carry on being master of your health. And that's what we like to say at DrToYou, becoming a master of your own health. Take control of your health. All the best.